Hi, and welcome back to Your Autism Game Plan. I'm Joya Vanderlaan, a family nurse practitioner, a functional medicine specialist, and an autism mom. Did you know there's a vitamin D receptor on every single cell in each and every one of our bodies? That indicates that vitamin D is an important piece of cell functioning. Every cell in the body needs vitamin D. When was the last time you had your child's vitamin D level checked? Has it ever been checked? How about yours, for that matter? Have you ever had your vitamin D level checked? Vitamin D plays a role in every single system and every single cell in our body, including immunity, gut, bone health, hormones, neurotransmitters, pain, inflammation, energy, sleep, and many more things. It even has a role in preventing heart disease and cancer. We cannot discount the importance of vitamin D for our general health, but also for our children's specific autism-related health. In terms of dosing vitamin D, we measure the dose in something called IUs, or international units. Many things are measured in milligrams. Vitamin D happens to be measured in IUs. The recommended daily intake of vitamin D for a young child, infant, toddler, is around 400 IUs. From everything I've seen in practice and in the deeper dive into the vitamin D literature and research, that is going to be inadequate. That's going to be enough to prevent your child from getting rickets, where the legs bow out, but it's not optimal. So, the very, very minimum dose they're saying is 400 IUs per day. Okay, well, what's optimal, right? There's a lot of gray area between let's not let my child get rickets and how is their body going to function best? How are they going to be healthiest? How is their immune system going to function best? How is inflammation going to be handled best? At what vitamin D level? A very rough general rule of thumb for dosing on children is about 1,000 IUs per year of age. So a 5-year-old, 5,000 IUs, and so on. Now, you do want to monitor vitamin D levels. Vitamin D being a fat-soluble vitamin, it is more difficult to overdose on vitamin D than some sources may have you think, but it still is really wise to get your child's vitamin D levels checked. Recently, a lot of labs have come out with ways to test vitamin D in blood with only a finger stick. So you poke the finger and drip the blood on a little absorbent card and send it into the lab. This is really easy, much easier than a blood draw, especially for a lot of our kiddos who, have different fears and aversions. So it becomes really, really easy to check your child's vitamin D level. I would recommend checking yours at the same time and seeing what is your vitamin D level. So if you decide to do that, or if you already have your vitamin D level for some reason at home, you'll notice a typical range, normal range, is about 30 to 100. So below 30, you're technically deficient, and thinking about deficiency syndromes and effects. Again, that's not optimal. Typically what I aim for in my patients is around 80, or between 80 and 100. This is really much better, optimal for things like immunity, inflammation, gut health, all sorts of other things. So we really want to make sure that our vitamin D levels and our children's vitamin D levels are in the optimal range, not just in the normal range. In another of my recent videos, I talked about medications and nutrient deficiencies. Vitamin D is a perfect example. For a lot of our kids, they have these GI complaints, maybe they're having reflux, so a lot of our kids might be on acid blockers, so PPIs, H2 blockers, things like Zantac, Prilosec, Prevacid, those types of things. When we decrease the acid in the stomach, we also decrease absorption of certain nutrients, vitamin D being a big one, magnesium and iron are others. So if your child is on an acid blocker, it's even more important to get that vitamin D level and make sure if it's low, in other words, if it's below the optimal range, that you consider supplementing with vitamin D3. Now, when we give vitamin D3, we want to give it with vitamin K2. D3 plus K2. Why? Well, we talked about in another video how lithium acts as a taxi to bring B12 into the cells. Do you remember that? If you don't remember that, go watch that video. So a similar thing happens with vitamin D3 and vitamin K2. There's a partnership there. Without vitamin K2, the calcium that is absorbed as a result of sufficient optimal vitamin D levels, the calcium actually is more likely to go and create calcifications on the heart arteries. This is somewhat age dependent as well and inflammation dependent. A lot of things are dependent on this. But it also can lead to calcifications in other areas which we do not want. So what the vitamin K does is make sure that the calcium that's absorbed as a result of those good vitamin D levels, that calcium is taxied to the bones to help strengthen the bones instead of creating calcifications in other places in the body where we do not want it. So remember, vitamin D3 is essential. It's best when paired with vitamin K2. So now you know the importance of vitamin D, just a little bit of the whole story. So remember, get your levels checked, get your child's levels checked, see where you are, especially important with COVID, being kind of this worldwide disaster right now, and with winter coming up, at least in our hemisphere here. So make sure your immune systems are in tip-top shape, your brains, your inflammatory systems are in tip-top shape by making sure that your vitamin D level is in the optimal range. Thanks for watching, and remember, be gentle with yourself. You're doing a great job.